Okay, hello. This is Valentina Miller, and my presentation, my quality improvement project is on catheter-related bloodstream infections prevention. Hospital-acquired central line-associated bloodstream infections, or short for CLABSIs, are serious but preventable infections when evidence-based guidelines for central line insertion and maintenance are properly prioritized and implemented. So the goal is to have zero infections incidents or no adverse events. So let's start with some background and statistics information. Bloodstream infections are one of the main causes of hospital morbidity and mortality around the world. These preventable infections are also correlated with extended length of hospital stay and increased healthcare expenses. An estimated 30,100 CLABSIs occur in the United States ICUs each year. Patient mortality rates associated with CLABSIs range from 12 to 25%, and the cost of CLABSIs per episode of care ranges from $3,700 to $36,000. Medicare used pay-for-performance in the Premier demonstration project to encourage hospital reporting of process measures as a means of improving patient safety. The Premier demonstration project was part of a value purchasing program initiated by Congress in response to reports by the Institute of Medicine about the preventability of some of the estimated of 1.7 million United States hospital-acquired infections in 2002, and the resulting 100,000 deaths. As part of the value purchasing program, Medicare implemented a policy on October 1st, 2008, that penalizes hospitals if Medicare patients acquire any of 8 conditions during their inpatient stay, including CLABSI. So if the patient acquires CLABSI, there's no reimbursement for the hospital. Now, CLABSI bundle. Insertion bundle interventions include appropriate insertion, site selection, thorough hand hygiene, strict aseptic technique during insertion, and 2% ChlorPrep. Research shows that femoral site is least suitable location for central line placement. Since this is a change project that has to occur on the progressive care unit, there is no influence on catheter insertion techniques. However, nurses on this floor are responsible for site and catheter maintenance, and the doctors are responsible for catheter insertion. On the floor, nurses should review line necessity daily and consult with attending physicians. If there is no longer need for the line, nurses should obtain an order to discontinue the line. Hand hygiene is essential in any infection prevention, including bacteremia. Scrubbing the hub of the catheter with alcohol wipe for at least 15 seconds and then allowing it to dry completely is a gold standard that should be implemented each time before line use. Current policy 30617 calls for scrubbing the hub for 15 seconds with alcohol, flushing with pre-filled syringe with 10 ml of normal saline before and after each use. For dressing changes, using sterile technique weekly and when dressing is visibly soiled should be done. Sites should be dressed with clear film dressing and biopatch to prevent infection. So despite the fact that all of the above strategies have been implemented in this hospital, there are still incidents of CLABSIs leaving the room for improvement. The hospital has been following the guidelines of the infection prevention, but there are still some gaps. since these interventions have shown significant decrease in CLABSI's prevention in clinical studies. They should be continued. However, additional staff education and re-education is still needed for improvement, as well as additional interventions. Key stakeholders of the problem are patients and families, who should be educated and complying with instructions in regards to central line management. Everyone should be advised to perform frequent hand hygiene. Patients should avoid excessive touching of the site and should be instructed to put their hair up to prevent dressing displacement. Now, nurses and doctors should follow the insertion bundle techniques, while nurses should follow the maintenance bundle techniques, which include site dressing changes and scrubbing the hub and proper hand hygiene. Also, line reassessment. Also, infection prevention team should step in and should monitor patients' chart and nurses and doctors' compliance with policies. Hospital administration should be a consultant in order to provide additional fundings for purchasing of additional materials that will be discussed in the next slides. Additional policies in terms of maintenance bundles should also be changed. So, as one may think, successful implementation of tools such as alcohol infused pore protectors should require additional resources. However, as we will see, it's not always the case, and sometimes we need to go beyond the bundle and add additional strategies such as chlorhexidine bath or wipes daily, staff and family education, and use of alcohol-infused hubs. So research shows that there's up to 86.2% improvement when alcohol-infused caps or port protectors are utilized. On average, it costs about, as we saw, about $3,500 to $36,000 to treat one CLABSI. Besides the fact that using pore protection can potentially save lives and prevent harm, it can also save up to $500,000 a year. So research also shows that there's better compliance with cap application versus 15 to 20 minutes traditional scrub the hub technique that many nurses unfortunately do not follow. Also, research shows that chlorhexidine gluconate wipes or baths are effective in CLABSI prevention when used daily on those patients who have central lines in place. There's need to add this particular item into the policies and procedures. One of the current catheter-associated urinary tract infection prevention strategies, which are also not reimbursed by Medicare, include daily order renewal for the line. So the same process should be done for central lines as well. Doctors should put in the orders for central line continuation after reviewing medications and microbiology results such as blood cultures. Some patients might just get the peripheral IV inserted, and that should be enough for administration of medications and fluids. Infection prevention team and leaders. Now, research suggests that there are several promoting factors that contribute to CLABSI prevention, and those are leadership, education, data collection, and consistency. It's been concluded that even though infection control professionals play a crucial role in infection prevention, they should also consider the bedside nurse's opinion during the process of development of the infection control measures. For that reason, nurses should be asked for suggestions and opinions during monthly meetings. And leaders should clearly state the goal of zero occurrence of CLABSIs, as well as initiate policy changes. Now, how all that should be done? In order to implement the above changes, quality improvement team as well as policy committee must be involved. After reviewing benefits of the interventions, policy should be added into facilities policies and procedures. So based on the project, we're going to talk about central line renewal orders, daily chlorhexidine baths, and benefits of port protectors. In order to evaluate our interventions, we will basically continue doing what we're already doing. CLABSIs are already monitored each quarter. Once the changes occur and policies are implemented, quarterly evaluation of CLABSIs should be continued and compared to previous incidents. After, let's say, 3 quarters, results should be compared to pre-intervention data. If there is no statistical improvement, additional strategies and interventions should be researched and added. The bottom line is that there's no one perfect intervention that helps prevent CLABSIs. It's a bundle of interventions, and we can see that they have been added yearly and always require evaluation and adjustment. And here's the list of references that I've used for my presentation.